We did the scan as a part of a routine, and after the routine scan we find an ovarian cyst. It is so common. Are you aware about 30% of the girls ever in their life would have an ovarian cyst? I am Dr. Shilpa Bansal. I am gynecologist practicing in Andheri West, Harleys Clinic. This is one of the very common things that we see. We see the patient coming as a part of a routine scan, but there is an ovarian cyst present, and we are certainly worried about what's happening. Let me talk to you about a story of a girl that was there in the OPD. Ria, not the real name for sure. She came to the OPD mentioning about that she has bloating, gas, she has pain in the tummy. After the scan, she had as a part of a routine checkup that she has an ovarian cyst of 4 cm. Ovarian cysts are so common, but they do not require a surgery or even a treatment. We just wait and watch for them for next 6 weeks to 8 weeks, they dissolve by itself. Let's just dive deep into an ovarian cyst and understand what exactly it is. Ovarian cyst is a fluid filled like a balloon filled with the water present in the ovaries. Every month when we ovulate, the follicle releases the egg which is caught by the tube, but the follicle releases the fluid in the tummy. That's why some people feel the cramps, pains during the ovulation. Sometimes rather than follicle releasing it, it covers up and it forms the fluid inside the follicles, forming a cyst. These are known as functional cysts. They are filled with fluid. They usually are about 4 cm or less than that, and without treatment they would be okay in next 2 to 3 months time. Sometimes the follicle not only releases the fluid, there is a minor bleeding in it, forming a hemorrhagic cyst. Hemorrhagic cysts are painful. Usually people come with the pain and bloating with the hemorrhagic cyst, but hemorrhagic cysts also do not require any treatment. They dissolve by itself in 2 to 3 months. We sometimes do start giving them painkiller, anti-inflammatory medications, and sometimes the tablets that make sure that the periods are fine, though the evidence proves that having a birth control pill to correct the ovarian cyst do not work all the time. The next most common reason we see are dermoid cysts. Dermoid cysts, they are like a cyst which is there from the childhood. These are cysts which are small until the dermoid becomes big, problematic, troublesome. We do not take a call on removing them as well. But yes, dermoid, if they are increasing in size, if it is painful, they would require us to treat it. The other cyst that we see is endometriosis. Endometriosis is the menstrual blood which supposedly is supposed to express out of the uterus, get deposited in the tubes or in the ovaries, forming a cyst. This causes a lot of painful periods, crampy. Though the size of the cyst does not coincide with the amount of pain, there can be a small cyst but a lot of pain, there can be a big cyst with no pain. So we have to really decide and personalize the treatment depending upon the symptoms, the presentation, but not only the size. The other most common reason are the tumors. We call that as cyst adenomas or mucinous cyst adenomas or a serous cyst adenomas. These are the ovarian cysts that require evaluations, treatment and surgery.